Hello, Space Coast. I'm Ron Lighthall. Once again, in our studio here on beautiful Merritt Island, I have Corey Board with Board and Associates, and we're going to be talking about Medicare options. And to me, Medicare is just one big blanket term, but you're about to dispel all that I know about Medicare. So, Corey, tell us about the different options and the different structure that Medicare carries.
Okay, thanks for having me. Also,
it's always great to have you in here.
Yeah. So as far as Medicare is concerned, yes, it's not a one-size-fits-all program, and there are multiple options. You know, it's like alphabet soup. You got Part A, Part B, C, plans. You know, from A through N as far as the Medicare supplement plans are concerned. So it's definitely confusing for newly eligible Medicare recipients, right? But again, that's where I come in. So we'll just go over some of the basics. What we are entitled to, and this is if we have put in 40 quarters, or which equates to 10 years of full-time employment paying into Medicare, is Parts A and B, so Alpha and Bravo. Part A, it's basically the hospital insurance. I like to say it's like the hotel room, because that's pretty much what it is. So the hospital room, and then the skilled nursing care or rehab center room, okay? Everything that happens within the hospital, the doctors, the procedures, the ambulance that got you to the hospital, the medications while you're there, falls under Part B, as in Bravo. That's the major medical. You're also eligible for Part D, as in Delta. D is for prescription drugs, but drugs or medications that are self-administered. So ones that you pick up at your local pharmacy and take at home is covered by Part D. So that's Parts A, B, and D. That is original Medicare. Okay, outside of that, you have another option. It's one or the other. You can't have both. You could opt out of original Medicare and choose Part C, as in Charlie. Okay, Part C are also known as the Medicare Advantage plans. Those are the HMOs and PPOs. Those are the ones you mostly see advertised on television. They have to abide by everything that is included in Medicare Part A and B, but a lot of programs would give additional benefits, like a little bit of dental coverage, vision, maybe hearing coverage, gym membership, you know, things of that nature, depending on the plan and your area, you know, etc. There is yet another option, and that's if you get into what's called the Medicare supplement. Now, Medicare supplements only work with original Medicare, okay? And the reason for Medicare supplements, they're also called Medigaps, by the way. Gaps, as far as they pick up the gaps of original Medicare.
Much like car insurance, when you purchase that gap insurance,
similar,
it
yes.
covers that difference.
Yes.
You know,
yes.
Literally covers the gaps in your coverage.
Yes. So as far as Medigaps or Medicare supplements, again, there are plans A through N, and there are a few letters that are missing in between that have been taken away or is no longer available. But pretty much, depending on which plan you choose, they would cover the co-pays, deductibles, and any co-insurance that you're liable for with original Medicare. Okay, so the reason why the Medigaps are around is especially with respect to Part B Medicare. Remember, that's the major medical. Well, on the original Medicare side of the fence, there are no what's called maximum out-of-pocket caps. So the way Part B works in 2022 is there's first a $233 Part B deductible. Once that is met, again, it's the lowest deductible we've possibly ever seen, $233, right? But once that is met, the patient is required to pay 20% of the Medicare approved charges. Medicare would cover 80%, the patient's liable for 20%. But that 20%, there's no cap. See, so 20% of a big number, Ron, could be
And grow and grow and grow.
be a big number,
Okay.
right? Yes. So that's where things like the Medigap comes in and helps alleviate that exposure to a retiree's assets.
So tell us a little bit about the difference between Part C versus the original Medicare.
So I'm gonna keep it simple. Okay. So with respect to original Medicare, it's not an HMO or a PPO. So with that said, you could pretty much go to most. So when I say most, over 90% of providers, hospitals, etc. in the U.S. and U.S. territories accept original Medicare. Whereas the Advantage plans, also known as Part C Medicare, are tied to networks. They're managed healthcare programs. Yes, there are PPOs also that allows you to go out of network, but you're still dealing with networks on the Part C side of the fence. Okay. In contrast, though, and again coming back to what we said previously about the Medicare supplements, is that on the Medicare Advantage plan side of the fence, there are maximum out-of-pocket caps. So it may be $5,500 or $3,700 in network, but once you meet that out-of-pocket cap, you basically have 100% health insurance for the rest of the year. So those caps, those caps are good, but you're still dealing with networks. Whereas original Medicare, there are no networks, so you have, for lack of a better term, free reign as far as seeing which provider may be best suited for your needs. But then you don't have caps, and then the Medicare supplements come into play to cover those caps.
So I'm also hearing from what you're saying that education and information is critical when it comes to navigating the Medicare system.
Yes.
So whether you're new to the system or you've been in it for a number of years, it's extremely important to reach out to you and your staff to kind of walk you through, I don't want to say the minefield, but walk you through the precarious ins and outs of the system, if you will, until you're comfortable with making the right decision, because it's so important, because you're dealing with your health care.
Yes, and it's actually the health insurance that we would have for the rest of our lives, right? So it is very important. And in fact, I would think the most important time is when someone is newly eligible, okay? Because there's something else. You see, Part A and B, a primary insurance. Part C, the Advantage plans, those are primary insurance. So what we hear every year, we could change and go back and forth and that sort of thing. Yes, you could. A and B and C, you could every year change things around. But as far as having a Medicare supplement, it's not that easy. You see, those are secondary position insurance. So those don't go by the rules as far as not having to medically qualify from year to year. So for folks newly eligible, there are different enrollment periods in which no health questions are asked. The application, the health questions are left completely blank. But if those periods expire, let's say someone is, years older, whatever the case is, they may find themselves in a predicament where they may want a supplement because it would make the most sense, but now there's a diagnosis and they're not able to qualify for it. So it is extremely important, especially as you're aging in or newly eligible for Medicare, to sit down with someone like myself so we could put everything on the table, analyze pros and cons, whatever the case is, so that you can make an informed decision.
And it is one of the most important things that you can do for the rest of your life
Definitely.
is to make sure that they reach out to professionals like yourself at Board and Associates, you and your staff, and get that on the right path, because one little hiccup or mistake, like you said, can cost you and set you back.
The clients I sit with, you know, the way I address it is this insurance, because it's to do with our health, and as we get older, stuff happens, right?
More frequently.
Yeah. So it is insurance we're going to use, you know. Your vehicle, homeowners insurance, etc. You may never put a claim in. Some folks don't put claims in all their life. But the health insurance, as we get older, and this again, it's for the rest of our lives from 65, or if on Medicare disability at a younger age, but it's something that's going to be used.
I was just joking the other day. I said, you know, we were talking about going to the theater, and I says, I've been to more doctors this year than I have movies. So that kind of tells you reach a certain age and your maintenance becomes a little bit more prevalent. You start to see doctors, and they're more specialized in things. But Corey, thank you so much for coming into the studio today.
Thanks for
It's
having
always
me.
great having you in here, and you bring so much great information. Once again, share with the audience how they can reach out to you, phone number, website, and again, how important it really is to understand Medicare immediately, if not before you go on it, but immediately when you're about to enroll into it. You really need to know the ins and outs.
Yes, yes. I'm Corey Board again from Board and Associates. The office number is 321-252-2340. Our website is www.baapa.us. It's very important to sit down with someone like myself to go over all your options, because as you get older, this is an insurance product that you're going to use.
Corey, thanks for coming to the studio again, and we'll see you next month, and we're going to have another fresh topic, but always so much great information. So thanks for joining us today.
Thanks for having me.
Board and Associates PA. We're dedicated to providing insurance solutions for individuals, families, and businesses throughout Brevard and Indian River counties. As an independent insurance agency with access to multiple national carriers and established resources, we'll help you build customized solutions to meet your unique needs.
What they offer is in line with what we were looking for. They would provide us with pros and cons on each one of the options. They left the decision up to us. We've been very happy with it.
Call or visit us today at Board and Associates PA.